the White House tonight, where President Trump dropped his new health care plan. Here on the same day, the window for Americans to enroll in an Obamacare plan closed in most states, leaving millions now in limbo.
The Great Health Care Plan, that's the name. It's called the Great Health Care because it's great health care at a lower price. The big insurance companies lose and the people of our country win.
So take a look here. The president's proposal aims to lower drug prices and reduce health insurance premiums. It would also send money for health insurance coverage directly to Americans as opposed to current standard of insurance companies. Now, he's also calling out insurance companies to be more upfront about their pricing, increasing transparency on overhead costs and denial rates.
If this plan is put in place, every single American who has health care in the United States will see lower costs as a result. They will see more transparency. All of these proposals that are within the Great Health Care Plan are incredibly popular with the American people.
Now, the plan does need to be passed by Congress. ACA subsidies, as you know, expired just a couple weeks ago at the end of 2025. There is right now a bipartisan effort underway on Capitol Hill to come up with an ACA extension.
As politicians on both sides of the aisle push their affordability agendas, Senate Minority Leader Chuck Schumer laid out a plan today to address high costs for Americans, saying Democrats will spend the rest of the year tackling the issue ahead of the midterms.
An unprecedented federal investment is on its way to rural communities nationwide to help improve health care. The Trump administration is doling out $50 billion in awards in all 50 states. Joining us now to talk more about this and much more is the administrator for the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Happy New Year. Thanks for being here.
Happy New Year, Taylor. It is the largest program of its kind ever. The $50 billion represents a 50% increase in the amount of money that we're putting into rural areas from Medicaid. And just to put it in context, Taylor, if you live in rural America, your life expectancy is shorter. We're having a major problem in this country because your zip codes are dictating your life expectancy. You don't have access to care. There's not availability of newer technologies. We have problems with paternity mortality rates, all kinds of problems that none of us in America want to acknowledge, but it's unfortunately there, and it's been there for a while. So the president and Congress said, we're going to give $50 billion, $1 billion to each state over the course of 5 years. Wow. And the point of the money is not to pay the bills. That kind of money you use to completely resize the program, to get to the root cause of why it's not functional. For example, can we improve the technology that's available so you get telemedicine, or even technology within hospitals so they can take better care of patients? How do we connect the big hospitals to the small hospitals? How do we get people to go work in rural America, doctors, nurses, PAs, et cetera? But also, Taylor, and this is an important issue, much of what holds back the ability of rural America to be healthy is old-fashioned rules that just need to be changed. And by giving money to governors, but not letting them keep it if they don't deliver, we're actually putting a lot of pressure on the states, which is a good thing because governors can use that as ammo to say, guys, we need to change how we do licensing. We need to change how we deal with credentialing. We need to deal differently with what we allow to have happen in clinics and hospitals across the country.
Yeah, all about helping everyday Americans in these rural communities. Now, I want to shift gears really quickly to talk about this. With fundamentally different approaches to health care policy, of course, Democrats and Republicans are still not seeing eye to eye, Dr. Oz, on a path forward now that ACA healthcare subsidies have expired. So can you tell us more about that next deadline to fund the government, January 30th? Are we on the verge of another shutdown due to healthcare policy?
I think the major focus of the nation needs to be reducing the actual cost of care. Throwing money at insurance companies with the hope that they'll spend it wisely to reduce healthcare costs is not a wise move. Why? Because if you give the insurance companies a lot of money, they're not really incentivized to reduce costs. What we need to do is literally go into the system and say, okay, first of all, who's the most important stakeholder? It's you, Taylor. It's the people watching the show. We want them to be healthy. It's the most expensive thing in medicine, bad care. Because you pay someone to do a bad job, then you pay someone who's good to do a good job, then you got to fix the problem and pay for the complications. And so I would like to flip it upside down. The president feels strongly about this. Give the money to the people. Let them wisely use their money to get the best care possible. We're building out all kinds of tools at CMS, the agency that I run, Medicare and Medicaid, to actually give you in your hands the ability to reverse some of the chronic illnesses. The most favored nation drug pricing that we've been advocating for and been accomplishing with the president's leadership leadership over the last several months, that's dramatically dropped the price of medication starting this year. Imagine being able to get that weight loss pill, the so-called fat shot, as the president calls it, not for $1,200, but for $250. In fact, in Medicare, we're giving it for a $50 copay, and in Medicaid, it's going to be free, basically, as states join on. So we believe these weight loss drugs are going to be, together with diet and lifestyle, important in reducing complications from obesity. That drops the cost of care so much that it actually is not going to cost us any money to get these drugs for the American people, because we're going to have less heart attacks, less strokes. But that also means a lot more people with their kids getting married, a lot more folks enjoying life, working longer, contributing to the economy.
Yeah, literally life-changing. So, speaking of CMS, which you're the head of, I want to talk about some other big news coming out. Of course, we talked at the top of this interview about that $50 billion investment in rural health care, which is incredible. But also, there's some big changes to immunization practices. Can you talk briefly about that?
Well, Secretary Kennedy felt passionately about this, but so has the president. They're all pro-vaccine, as am I. The question is, are we giving the right number of vaccines in the right situations? Can we do a better job examining the impacts of these vaccines to give everyone comfort that they're as effective as we hope? And this, again, something every parent does. You put your kid in a car seat, you assume the car seat's safe, but you check just in case. Did I buckle it in right? Is it strapped correctly? That's all stuff that we historically have taken for granted in the vaccine space. We ought to do it again. Many of these vaccines are older. We should just double check with randomized trials how effective they are. In the meantime, give people choice. My job is to pay for the vaccines. So I can tell you that no matter what happens, you're going to get the vaccine for free if you want it. But it should be your decision whether you want to get the vaccine.
Dr. Mehmet Oz, Centers for Medicare and Medicaid Services Administrator, as always. Thank you so much for being here with us.
Taylor, appreciate it. Happy New Year.
You too.
This morning, President Trump urging Congress to immediately pass legislation on his health care overhaul aimed at replacing Obamacare and lowering costs. Yesterday, Trump released a 5-minute video message laying out what he calls the great health care plan. Those key parts of the agenda do include lowering drug prices by expanding access to over-the-counter drugs and using most favored nation pricing, maximizing price transparency by requiring providers to post all costs and prices up front, and giving money to consumers directly instead of insurance companies.
Today, I'm thrilled to announce my plan to lower healthcare prices for all Americans and truly make healthcare affordable again. We're doing things that nobody's ever been able to do. We're calling it the Great Healthcare Plan. Instead of putting the needs of big corporations and special interests first, our plan finally puts you first and puts more money in your pocket. The government is going to pay the money directly to you. It goes to you, and then you take the money and buy your own health care. Nobody's ever heard of that before, and that's the way it is. The big insurance companies lose, and the people of our country win.